Hi, this is Dr. Abdul, Physiotherapist. Welcome to my channel. We have often heard that anatomists and healthcare providers, whether physicians, surgeons, physiotherapists, nurses, etc., often uses the terminology that can be confusing to layman or ordinary man. However, the purpose of this language is not to confuse but rather increase precision and to reduce medical errors. And that's why it's regarded as universal language. No matter what native language the country has, the medical language will be the same throughout the world. Learning anatomy is similar to building a house. If the foundation is strong, then it will last for a lifetime. This subject is definitely difficult and filled to the brim with details, but the basics keep cropping up time and time again and again during your entire course of the education and entire your career as a doctor. So learn the anatomy like you're building your foundation for your medical career. Human anatomy. The word anatomy comes from a Greek root that means to cut apart. Human anatomy is the scientific study of body's structure. Gross anatomy is the study of larger structures of the body, those visible without the help of magnification, and hence referred as macroscopic anatomy. Whereas some of these structures like cells or tissue are very small and can only be observed and analyzed with the help of a microscope, hence referred as microscopic anatomy. So these are the two subdivisions of human anatomy. What are they? Macroscopic anatomy and microscopic anatomy. Anatomical terms. We all know how important anatomy as a subject is for medical student or for practicing doctors. But for a student who is learning anatomy for the first time, remember that to understand anatomy better, you need to understand anatomical terms. And to understand the anatomical terms, you need to know how it is formed. So, any anatomical terms will be formed with three basic words, that is roots, prefixes, and suffixes. So, the root of a term often refers to an organ, tissue, or condition, whereas the prefix or suffix often describes the root. Let's see an example of the prefix first. The word pericardium. Here the prefix part is peri, which means around the heart or membrane covering the heart, and the root part is cardium, which refers the heart over here. So a term pericardium having the prefix peri is nothing but the around the heart or membrane covering the heart, and cardium is a root term which refers to the heart. Similarly, suffix example, as you can see here, bronchitis. The suffix part is itis, which means inflammation, and the root part here is bronchus, which is a part of an airway system. So in total, the term became bronchitis. Together bronchus and itis becomes bronchitis. So this is how the anatomical terms are formed by roots, prefixes, and suffixes. Anatomical position of human body. As you can see in the video, this is how a human body projected in anatomical position, which is nothing but like body is erect, feet together, palms face forward and thumbs point away from the body. So this is how the human body should be projected in anatomical position. Thanks for watching. Follow me at YouTube, Facebook, Instagram, and for any business related enquiry, contact me at dr.abdul.pt@gmail.com.